Good afternoon, Gothenburg. Thank you for taking time to tune in to another town hall meeting. I appreciate the number of respondents that we've had able to participate with us today with short notice. The last meeting that we had like this was on June 4th, and we decided that we were not going to continue to have these meetings until there was a need to get more information out to our community. Conversation began with the hospital towards the end of last week on setting up another meeting like we have today to get accurate information out into the community. So I want to thank all of the people that have tuned in today, but then a special thank you to all the panelists who have agreed to participate with us today. I wanted to start out, sometimes in these trying times, I look to different philosophers and try to look to maybe people smarter myself for guidance. The most appropriate philosopher that I could find in today's current situation was the sage Mike Tyson. And the Mike Tyson quote that I think that applies to the situation that I find myself in is, everybody has a plan until you get punched in the face. And I think that mirrors what my experience has been. As we've gone through this as a community, we've really seen an escalation in numbers here recently. Some of you may know that we have had a direct positive test within my own household. And so that's really brought this home, something that was very important and personal to me many months ago as we started this process has become even more important and personal to me as we've gone through this process. So thank you for tuning in, and thank you for taking time to educate yourself. The whole point behind these town hall meetings is to educate yourselves. And then our ask that we normally wait to ask until the end is that you take what you learned today and share that with other people. So with that, we're going to jump right into some questions and comments from Dr. Dalrymple. Dr. Dalrymple, thank you for taking time to be with us today. I know the Health District Two Rivers reports instance data on a countywide level, and that's the most accurate reporting that is available. The hospital may not have complete information about Gothenburg specifically, but in general terms, can you tell us a little bit about what you've seen as far as tests and testing and test results?
Yeah, thanks, Nate, and good to see you again, although again, I wish we didn't have to go back to more of this. So going into what we do know, we had a pretty uneventful May and June, which was great. And about 2 weeks ago, we started to just see a small uptick in cases. And then last week, we really had a big, I would call it a sharp increase in positive COVID cases. And what I think is important to note is that it was local community spread that I felt we were seeing with those numbers, not people from out of state or people traveling through. It was a local spread. So I think that's important to note, and why I think we're kind of doing some of these, doing this call. So I know that we'll get into some more of that information later, and Two Rivers is going to talk about some of that. But another important thing that we are noticing is that the percentage of cases are actually going up that are positive. And that is definitely a concern for increasing spread of coronavirus. So I did want to talk about that. A couple of other things I was going to bring up. If you are going to come up and have a test, a lot of people have probably heard that we have a rapid COVID test, which is great. It's a test that once it starts running, we have results in 15 to 20 minutes. Now, due to the fact that we are starting to test more people, given the need right now, we have to sort of triage that to make sure that we prioritize more patients who are more sick and make sure that they have a rapid test. So we still do have the test that takes 1 to 3 days, usually like I think it's 3 days to get those back. So you may not be offered a rapid test. I just want to make sure people know that. It depends on symptoms and how severe your symptoms are. I would say actually it's probably a good thing if you're not offered a rapid test, because it means that we feel that we can wait to get that result for a couple of days. So I think that's important to know that we do have the rapid test, but we still have the test that takes about 3 days to send off, and we're using both right now to make sure we're using our resources correctly. Trying to think what else I can tell you. I know that one thing we want to impart to people is please call us first. Please don't walk in, and that's for your safety as well. We want to know who's coming in, and if we have concern for positive COVID cases in our hospital, we want to make sure it's the safest environment for everybody.
So Anna, just to that point, so if somebody is potentially notified by the health department that they have been in direct contact with somebody who would be COVID positive, what steps should that person take? What's the next thing that person should do upon receiving that notification?
Yeah, so, and I'm sorry, you said if they were actually contacted by the health department or that they had
Correct.
a significant close contact. Okay, so the next best step would be to start quarantine, meaning that you may not necessarily have symptoms, but that you're going to stay at home. You're not going to go to any social events, and you're going to avoid other people just in case you do have the virus. And then you can call us and get an appointment to be seen and potentially get a test. I think it's important to understand the difference between a very brief encounter and significant close contact with somebody who had the virus. And so significant close contact, we define that as within 6 feet of somebody without a mask on for at least 15 minutes. It also includes if you're directly sneezed or coughed on by somebody who has the virus. And it also includes if you've been hugging someone, shaking their hand. Again, you have to be within 6 feet of someone to do that. So that's important to know that. If it was a very brief, walk by somebody and that's it, that doesn't count, which is good. But just kind of keep those definitions in mind for what counts as close contact.
Sure. And so, yeah, I think there's a lot of question or ambiguity as far as what is defined as close contact. And that really helps me to understand that it's prolonged for 15 minutes within 6 feet without a mask, or that close physical contact. And I think it's easy to find yourself wondering, was I in close contact or was I not in close contact? And thinking back to months ago when we were all learning about the virus, I think there was some question and concern about surface transmission. Any insights to share on the likelihood of surface transmission at this point in time?
Yeah, so time is your friend with surface contact with the virus. It really has to be the perfect storm for you to pick up the virus off of a surface. By and large, most transmission of the virus is coming directly from contact that you have with somebody's respiratory droplets, and not usually from touching a surface. So the virus can live on certain materials, depending on the material, for up to 72 hours. However, after even just a couple of hours, the amount of virus that is still alive on that surface is so low that it's very unlikely. I think that some of the research has even shown that it's not possible to get an infection after a few hours. So it would have to be that perfect situation. Maybe somebody who has high levels of the virus, they're very sick. Maybe they put their hand over their mouth and they sneezed and they have millions of viral particles on their hand, and then they touch a surface, and then immediately afterward you touch that surface, and then you touch your mouth. That is the perfect storm for maybe getting a virus from a surface, but by and large, most of it's going to actually be a respiratory, from some of these respiratory droplets.
Great. Thank you. I am going to pivot to Jeremy with Two Rivers with some questions for Jeremy. So Jeremy, thank you for taking time to join us today. A big thank you to you and your team for all the work you're doing on behalf of all of us to keep us safe. Jeremy, as we've seen an escalation in numbers, I guess, can you just talk to us a little bit about the escalation that we're seeing and why potentially we're seeing that escalation?
Yeah, absolutely. Nate, thank you so much for organizing this today too. And apologize if you hear any drowning in my voice. I'll try to project a little bit because we're obviously within 6 feet. You probably see that here for longer than 15 minutes. So some things that we're seeing as far as trending. Let me just go back to some of the data at this point. Some of this is on our dashboard on our website at trphc.org, but we've definitely noticed an uptick in our positivity rate, which I think everyone knows that term, but just in case, it's the number of positive tests versus the number of total tests that we receive any given day. And of course, that ebbs and flows throughout our district from private providers, health systems to the Test Nebraska. It all gets dumped into an aggregate fashion into our queue. It's over the last 5 weeks or so, like I said, it was hovering about 1% for a while and doubling every week. And this last week, we're at about 11% positivity rate. So, and it's projecting this week will be a busy week nonetheless too for us. But we're also seeing demographically a slight shift, and from community to community, it's a little bit different from what we're seeing, I guess. But in Dawson County as a whole, it's a little bit of a mix. We're seeing some of the younger population, a little bit of older population. In Buffalo County, for the most part, we're seeing the vast majority of that being 19 to 40-year-old individuals. So I think what we're seeing in the Gothenburg community at this point in time, we're seeing a cluster, obviously, in and around Gothenburg and kind of western Dawson County at this point in time. And it's related to a couple different events at this point, but nonetheless, the key take home, Nate, we really need to emphasize at this point is we definitely need to be social distancing. We need to be wearing a mask. We need to be washing our hands and staying away from people that are sick. If people are sick, which we know there's a lot of people that don't show any symptoms with this, but if they are symptomatic, like they think it's seasonal allergies or they think it's a sinus infection, put a mask on and make sure you're wearing a mask too. Those are probably the key things.
Do you anticipate any changes to any of the DHMs, directed health measures? Is that anything that you think is on the horizon, or what numbers would we need to get to before we'd see a shift there, in your opinion?
Yeah, that's a good question. And there's been ongoing discussion among the local health districts about DHMs. And there's been some press over the last week or two. A couple health districts have transitioned to we call phase 4, which is wide open, just recommendations at that point, no requirements. We're currently in phase 3, as everyone knows. At this point in time, I don't perceive we'll be changing in the near term. It would probably require a pretty steep uptick of cases, in addition to the health system metrics, which a lot of times on the calls of the governor, we're talking about that. That's really kind of what our end goal is in a lot of ways, is not overwhelming the healthcare system. Now, a lot of what we do in the public health sector, and where we appreciate all your great community support in this area, is preventing it from getting that bad. When we're to that point, when we're seeing a lot of people in the hospital, we're seeing a lot of people on ventilators, it's too late. We're already about 2 weeks behind at that point. So a lot of the work we do and we've been doing at this point is to prevent it from even getting to that point, quite frankly. And so that's why we created a community risk dial, because it helps illustrate a lot of the ways that we can help prevent that. And in addition, incorporating other metrics like personal protective equipment. Now, we're in a lot different situation now than we were back in March and April. At that point in time, quite frankly, we had a lot of our high-risk facilities, long-term care, assisted living, that had very little to no supplies of personal protective equipment. That being said, we've increased pretty good in that area. We still have a few deficiencies here and there we're working on, but for the most part, that's in a lot better setting. One of the challenges we have right now, quite frankly, is testing availability. And I'm not sure, with our folks on Gothenburg Health can probably speak a little bit better to this as far as in a local community, but we've heard a lot from our local partners in healthcare about the limitation either on the amount of testing to send in or the time frame it takes to get back. If you cannot get a test back within about, oh, gee whiz, our ideal time frame is like 3 days, quite frankly, for quarantine isolation. If it gets 5 days, 7 days, a week out, which we've heard from a lot of reference labs, it becomes pretty impractical in a lot of ways, putting public health controls in place.
To that point, what is an ideal time to be tested after what is a prolonged contact?
You know, with the tests we have, I think it's important to go back to the way the testing is done. It's typically a DNA test. The vast majority of our tests that are out there now, and it's a spot and time test. And so if you have enough RNA, from the virus that's in your system, that's picked up by the swab, that then is tested out, test positive, that's biologically the correct time. Now, what you're asking, I think, is what's the correct time, symptomatically? Well, the challenge we have is it's so variable. And with this, there's so much mimicry that goes on with this. You could be having some indigestion. Like I said, you can have some of the allergy type symptoms in our younger population. So it really comes down to the best time is when you're symptomatic with the symptoms that you believe align with COVID. That's the best time to get tested.
Great. So as an example, let's say we're in normal times, and Jeremy, you and I had a lunch date on Wednesday of this week, and you and I were able to go break bread together. I'd really look forward to that, but that's just not where we're at today. But in my fantasy world, that is where we're at. And so you and I go share a meal together, and then I find out later that week that I'm COVID positive. Can you walk me through what your protocol is? Say you find out on Friday that I'm COVID positive. We broke bread together on Wednesday. What's Jeremy do?
Sure. So that's we'll go through like a contact investigation protocol that we follow. So typically, as you mentioned, we're always in arrears in a lot of ways. We don't find out the day that somebody is being inoculated with COVID-19, but usually it's several days later, possibly even a week later. And so in instances such as that, when we will typically receive a result or a report from either a medical provider or a health system or a lab that'll indicate, hey, this person is positive, then that's where our detective skills really have to go to work, where we have to contact you, Nate, for example. We say, okay, hey, I know Nate. I'm going to give him a call and find out who else has he been around in that time frame when he can typically would have been contagious. Now, the way we throw that net out as far as trying to identify those individuals that you may have been around is typically about 48 hours before you become symptomatic. So in individuals where there is symptoms, and we have to be very clear and acknowledge that we know there's a lot of people that are asymptomatic, have no symptoms at all, but people that do have symptoms and are severely sick, typically there's an onset period. It could be like a fever, it could be a cough, something like that that's pretty characteristic in that individual of when this would start. Then we go back 40 hours prior to that, and that's what we say, okay, who have you been around for more than 15 minutes within 6 feet of? Then were they wearing a mask? Were you wearing a mask? And it's not uncommon. I love the example of eating, by the way, because in our meat processing facilities, that's one of the major ways we saw transmission is during lunch and break times. Because what do you do when you go to break? You usually get a drink, you eat something. And we also see that in a lot of other outbreak type situations too. And that's just so important why the physical distancing, the social distancing, 6 feet is so important.
Yeah, great. Can you walk us through what those updated symptoms are? I think that's evolved some since February. And what would be the most current list of symptoms?
I'm gonna look to my team here to pull it up really quick, and I'll talk for just a little bit while they're doing that. How about that?
Yeah.
So, if we go back to March, early part of the year, we talked about cough, we talked about fever. Now those symptoms, shortness of breath, that's another one. They're very iconic in the severely ill individuals. Those people that have to go to the hospital because they have shortness of breath, those that end up becoming on a ventilator. Now, that being said, for our younger population or people that are more mildly symptomatic, it could be loss of taste and smell. It could be like a runny nose, like I said, allergy-like symptoms, congestion-like symptoms. They may not have those really severe symptoms. And there's some discussion going on nationally about fever. Fever is present almost as much as it's absent. So it's not the most characteristic indication, but it's really an embodiment of all the symptoms a person's having. And that's what really, so much of it is individualistic to some extent. But Katie's going to type in here a few things.
I'm talking to Dr.
Oh, sorry.
Sorry. I can tell you. So we also are looking for fatigue, body, like flu-like symptoms, headache. But one of the most striking that we do here, and it's especially in younger people or people who are mostly asymptomatic, is the complete loss of smell. So, and we're not talking like when you get a cold and you have a plug nose because there's so much mucus, you lose your strength in your smell. But for COVID, it's completely gone. You can't smell anything. They could spray perfume in your nose and you will have no reaction. And then sore throat, and they can cause congestion or a runny nose, nausea or vomiting, and diarrhea. Another striking thing that we hear, it's not officially on the list yet, but we hear a lot about pain and inflammation in your extremities. So hands, feet, joint pain, and that can be another indicator for COVID.
Yep. Any thoughts on an asymptomatic person versus a symptomatic person and their ability to transmit or spread the virus?
That's a great question, Nate. And there's been some pretty elementary research out there so far on that. There's some belief that if someone's asymptomatic, they cannot transmit as much. And I can't remember, Katie, was there one study that came out about that? I can't recall for sure. Let's just say there's not a great body of research done on this yet. That would be a great thesis project for somebody right now.
Great. Okay. Another question. I've heard two different terms, quarantine and isolation. Can you help me understand the difference between quarantine and isolation, and is there a difference?
Yep. So it gets into the weeds a little bit, into medical jargon, but isolation technically means you have symptoms and are sick. If you're quarantined, means you've been exposed and are at risk of becoming contagious. So when we say, and that's really how we differentiate the two, quite frankly, is someone that has tested positive and they could have symptoms, they cannot have symptoms, but they would be considered, or have the need to be isolated. They shouldn't be around other people. If they really need to go out in public, they should wear a mask, things like that. Where somebody that's quarantined, and I'm gonna go back to the example, Nate, that you shared. So in that situation, you would be isolated because you would have tested positive. We know that the tests are very reliable, the high fidelity, all those things. Where in my situation, if I was a close contact where we had lunch around the time period where you were symptomatic, then I would need to be quarantined for that period because I'm at risk of becoming sick potentially.
And then it seems like the guidance on the length of quarantine has evolved some. At one point in time, I remember 14 days, and then seems like I can remember 10 days, and maybe it's back to 14. Am I remembering some of that evolution correctly?
Yeah, I'm gonna let Katie answer that one for me.
Right. Okay. So, and it depends on what you're doing. So if you're healthy and you're in quarantine, we want you to stay at home. Don't go to the grocery store. Don't go see your neighbor for 14 days. And we do locally, when we do investigations, if we have someone who's in close contact and we're investigating their friend who got sick from them, we are seeing people get sick 2 days after close contact and 14 days after close contact. So day 14, it's still important to stay home and make sure that you know how you're feeling and that you're not sick. For isolation, we want you to isolate for 10 days. And then for the last 24 hours of whatever period that is, we want you to not have a fever and not use the aid of medication and have improving symptoms. So if you have a fever on day 10, then you cannot end your isolation. But if you start feeling better on day 3, we still need you to stay in isolation until day 10.
Okay, great.
Nate, and just one thing to build off that for just a second. People, I know there's a human notion, they go, oh, I'm getting close. I'm on day 12 of quarantine, or I just need to run down and get this, from the store. We've conducted so many cluster investigations, and quite frankly, one that's most searing in my mind was our first death in our district was related to a home health worker that she was in that time period, about 13, 14 days out, where we're really close to end. You think, oh, low likelihood that you would be transmissible to somebody else. And then that's ultimately what caused this to transmit to somebody else, which then caused them, of course, to pass away from that. So just so the 14 days are just so important.
Yep, appreciate it. Jeremy, early in your comments, you mentioned that there's a handful of events that you feel like a lot of the uptick could be attributed to. Not asking for the specifics of the event, but in general terms, can you share with the audience what are the attributes of those gatherings that we would want to steer clear of?
Yeah, absolutely. So indoor spaces. If you have indoor spaces where people are in close proximity, those are places I would avoid. If you look at social gatherings, it's the same thing. If whether it's inside, if you're outside, of course, we always think proximity and environment are so important. Indoor spaces, you're much more likely, the body of research is showing you're much more likely to acquire this, if you're in any respiratory disease too. There's actually been a study that we covered, it was during a state call not too long ago, it showed that actually it can actually be transmissible well beyond 6 feet. Let's say, we have a pretty long room here, but let's say we had an air conditioner blowing the air this way, and if somebody's sitting way out that end of the table, which is probably about 15 feet away from me, I could actually pick that up because of the airflow, quite frankly. So there's a lot of different environmental considerations in situations like that, I guess. But yeah, I think the biggest thing, social gatherings and indoor spaces. I think that's really where we're seeing a lot of those sort of clusters developing. There may be good practices and rules in place, at work or school or wherever you're at. But then when you go home and you just throw it out the window and go out and have a good time with your friends, then that kind of defeats the purpose of it.
Yep, perfect. And you bring up businesses, and I know going back to March, there was a lot of businesses that made fairly significant modifications, and I think many of us were learning and adapting on the fly. A common practice that I seem to observe was kind of a staggered work schedule that maybe have 2 different groups in rotation. And it seems like today we've evolved to more everybody working in the same at the same time, but trying to achieve physical distance or mask wearing. And just as we've evolved and understood proper protocol, it seems like that's the evolution where we've ended up with. Any thoughts or insights as to what businesses can or should be doing to maintain a safe work environment?
I think the successful strategies that we've seen, Nate, you've alluded to a lot of already. It's physical barriers that are erected. It could be staggered work schedules. Some businesses have chosen to move their break quarters, their picnic tables outside. The challenge is we know the Nebraska weather, it can be hot and sultry one day and then snow blowing the next. So that's a challenge of what we live in. But like I said, just trying to get that physical distance in space and also just the utilization of masks. And that's one thing hopefully you can see through Zoom. We're wearing masks here. That's one thing we highly encourage, and we're trying to lead by example. And it is a little bit of adjustment. I mean, if you've never worn a mask before, don't think you're just going to throw one on and it's going to be great. It takes a little bit of adjustment, but there's nothing from a health perspective, especially for those 5 years and older. It's usually if you're younger kiddos, it's not something we recommend unless you have parental supervision. Just a lot of things can go wrong there. So
great. Jeremy, in the question queue that we had opened up, seems like we've had a number of questions, and I know you've answered this before. How come we get countywide numbers instead of town specifics? Can you share that response with us one more time?
Yeah, absolutely. So it comes down to privacy in a lot of ways. That's probably the simplest way I can define it. So it's easy in a community the size of Gothenburg, if we have 1 or 2 cases or even a dozen cases, I think everyone can allude to, everyone knows somebody, right? We're all interconnected in a lot of ways. And even if we said in Dawson County, there's 1 case, well, you think of last time you heard about an accident on I-80, if it was somebody local, everybody knows pretty quickly, right? Well, when it comes to health information, we take it very seriously, our role to safeguard individuals' health. And just know, as many people that say, hey, we need to know more, there's that many and more that say we do not want our information shared. And so we're walking that tightrope, making sure that we're trying to inform the people the best we can of what's going on, but also making sure to safeguard individuals' private health information.
Yeah, I'm going to combine a couple of questions that were received in the queue. There's been a request for the names of people to be released, and obviously that's not going to happen. But I think there was a thoughtful explanation to why the request for names is because then it would be easier for those that would have had a potential contact to take proper actions. Can you walk us through what the protocol is once Two Rivers is notified of a positive test? What sequence of events unfolds to ensure that those people that need to be contacted are contacted?
Sure. Do you want to take that, Katie?
Sure. Okay, so we receive test results electronically, either through fax or through our electronic health system, and sometimes through hospitals, depending on how much contact we've had with them recently. Gothenburg is excellent. We love working with Gothenburg Memorial. And we start right away. So if whoever's reporting to us also reports close contacts, we actually at times will call contacts first, just to be sure that those people are aware that they need to stay at home, start quarantining right now. And then we do go through a process. It takes about, at this point, I think 45 minutes, and it's an extensive interview that we ask about symptoms, about where you live, about any kind of demographic information, so your race, your address, your phone number, anything that we may or may not know at that time. Hopefully we know your phone number so we can contact you. And then we go through and see what your symptoms are, and then who you have been in contact with. So most people, Nebraskans, are amazingly honest and amazingly thoughtful of other people, and almost every person we've talked to, when we ask them, who have you been with, can you give us names and phone numbers, and plan on us contacting those people, we receive plenty long lists of people to contact and ask to quarantine after they've been exposed to somebody who's sick. Often, because Nebraskans are so forthright, they will request that they themselves call someone before the health department does call them. So we notify whoever has been sick, we notify the people that they've been close to from their own information.
Great. And then once somebody is notified of that, then we already walked through that protocol with Dr. Dalrymple as to what proper procedure is once they do receive that call from the health department or from someone who would have notified them that they did have a positive test and they would have been in close contact. We did have Anna define what close contact is. That's such an important message for our audience to hear today, just because I think that allows our medical community to better serve the patrons of our health district. Can you guys give us another definition of what you would call close contact?
We have a good graphic. So we would say that anybody who has been indoors with you for more than 10 minutes and have been within 6 feet of you is a close contact. But if you are hugging that person or kissing that person, any physical contact, whether it's super long or super short, is going to make you a close contact with that person as well. And then any person that, I'm missing one.
Communal, one thing we've seen is communal living too. If you're living in an apartment, not different suites per se, but let's say it's a bachelor complex and you have like 4 or 5 guys living in the same apartment with you. If you haven't been separating yourselves out during eating times and things like that, then you would also be considered close contact typically.
I'll send someone over your way a list so that we can do it a little better.
What about travel in vehicles and so forth? I would think that would be another place where it would be easy to have that prolonged close contact is in a vehicle.
Yeah, absolutely. You're absolutely right, Nate. It's depending upon the vehicle there again, there's ways you can get away from that too. Let's say,
Public transportation.
Yeah, if you're in public transportation, there's some barriers erected. There's some situations where it's possible you would not be considered close contact. But if you're just thinking this like, hey, I'm jumping with a buddy, or a girlfriend of mine or something like that, you know, and roll for a ride, if it's longer than 15 minutes and you're driving, let's say, to North Platte or you're driving to Kearney, and you find out later that person, you know, was positive, then you'd be implicated also.
Yeah, and certainly in those public transportation or multifamily units of transportation, mask wearing would certainly help mitigate the risk at a significant level, correct?
Absolutely. And it's also something to think about too. You know, if you're in a vehicle, crack the window a little bit, it creates a negative airflow in some ways. But yeah, wearing a mask, definitely.
Yep, great. Jeremy, you had submitted to us some graphics. I'd like to take a few minutes now and,
Sure.
and maybe walk us through those graphics. So if we can get those up on the screen, I think on this end.
You may do a little commentary, Nate?
Yeah, that'd be great.
Yeah, sure. So what you see up on the screen now is a 7-day rolling average from across the whole district, the 7 counties. Now, that being said, to be blatantly transparent, the vast majority of our cases were focused in around Lexington and Dawson County during that first iteration. We saw a little bit of a second uptick, but with a 7-day rolling out average for those that are non-statistical and non-math oriented, it helps smooth out some of those individual disparities we see with a single day testing result. Maybe there's lots of reasons why we may have an uptick in testing on a single day. It could be maybe it's Monday and they held results from sending them out on Sunday, or, you know, there's all sorts of weird nuances, or maybe the courier was combined at one location to another day. But definitely over the body of it, you should see some of the same similarities for the most part too. And I think what you can see, I'm not sure if you can minimize this window here, Katie, so we can see the kind of that uptick. What I really wanted to show you with this was just at the very end of it, as we get towards the end of July, August, you can see we're starting to uptick again. And so it's a variety of different things. You know, it's not, you know, we're seeing some cases in Dawson County. The vast majority of cases we're seeing now are in Buffalo County. And we are seeing a much younger profile, like I mentioned before, specifically in Buffalo County.
Great. And probably that exposure rate at some of those events that were maybe indoor in nature could likely attribute to a lot of that uptick.
Yeah, absolutely. If you think about the time of the year too, I mean, March, April timeframe, even into May, still pretty cool out. A lot of workplaces that hadn't taken any mitigation steps yet too. Definitely some of the things going on there. And, you know, you see that kind of more of the flat line or lowland area from about right before June into like the middle part of July. We have to remember the context, environmental context that we're living in, is that we've been relaxing directed health measures for quite some time. And with that, you get more mobility socially and otherwise. And so you see more transient folks, you see more normal business operations in some ways too. And so we do expect an uptick. And there again, keep in mind, our goal is really twofold. Primary goal is keeping our health system metrics in check, making sure we don't exceed the health system capability to withstand that. In addition to, I'm not sure if Dr. Rhodes is on, I thought I saw his name on there. We want to get school started, quite frankly. And in-person school there's just so many significant benefits of school, and that's really one of our primary goals too.
Great. I think we're ready for the next graphic here.
Okay, you can see with this one, it gets a little busier. Same thing, we just extract out age categorizations. And this is across the whole district once again. And so you can see by far, and if you're like me, a good book, you always cut to the end, right? And so if you look towards August, you see that red line kind of almost like it took a little peak of sorts. So that's 18 to 29-year-old category. So that's what I've been talking about. It's been trending higher for quite some time, about 30 days or so, which follows a national consensus of what we're seeing, by the way, for COVID-19. The second age category, it's kind of mixed in with the rest of them, but we've definitely seen an uptick over the last several weeks in the 30 to 39-year-old category. So, and if you think about that, what's happened in the last 2, 3, 4 weeks, we've seen bars and restaurants resume to some extent some normalized operations. So that's in addition to sporting events, other community type events. that's to be expected in some ways, because if you think about who's out and about, it's typically, you know, a lot of our folks are a little bit more resistant to risk in some ways. And I think what you're seeing also that I like to see from this actually is that purple line, that blue line, dark blue line, that's our 80-year-olds or 90-year-olds. We're not seeing a lot of positive cases there. And that's good to see, and quite frankly, because when we start seeing that tick up, that's pretty concerning.
Great. Next graphic, please.
So if you look at my county here, this is a little bit harder to extract, but I think you can probably see Dawson County is more of a darker red color. And that's actually what you see kind of the peak from. And then you can actually see about mid-July, and when we baseline out, it actually falls below Buffalo County, which Buffalo County is that pink line. That as you move towards from July into August, that actually exceeds Dawson County. And you can see our other counties, Franklin, Gosper, Kearney, and Phelps. If we blow that up, what we'll see is Phelps actually, for the most part, is in third place. And I would be remiss if I didn't mention our largest population in our two district areas, Buffalo County. Our second largest is Dawson County. Our third largest is Phelps County. And so really what that's telling us is it's community-wide at this point in time. It's based on prevalence of our population in a lot of ways. And the things that we do as a population and community are things like hand washing, like social distancing, things of that nature. Those are going to be our most effective tools until we have a vaccine or pharmaceutical intervention.
Yep, great. And I think you had maybe alluded to this. A lot of the escalation that we had seen in Dawson County back in May and June maybe had ties to certain work environments. The most recent upticks would not necessarily be tied to that same vector, would it? That's probably more tied to those events, I would say. Would that be an accurate way to compare and contrast those two?
Yeah, I think that's fair, Nate. And that's what we really look at. The vast majority of our cases, I think over 65% of our cases could be tied back to food processing during that mid-April to mid-May timeframe. And at this point in time, what we're seeing is much more clustered events, not specific to that industry.
Yep, great. Next graphic, please, Alec.
Okay, so one thing wanted to drive out is a little bit of detail around just the cities in Dawson County, and we felt it's. Oh yeah, sorry, and Buffalo. So Dawson and Buffalo, sorry. Just to kind of extract out so you can see what we're talking about. So when we're talking about that time frame, I mean, the vast majority of those cases were in and around Lexington. And let me go into detail just a little bit without spending too much time. But the way this is defined is where an individual lives. So wherever your home address is how this is recorded. So let's say hypothetically, well, not hypothetically, we know there's a lot of folks in Gothenburg that drive to North Platte and Kearney and other places and go to work in different towns. It follows you home is the best way to say it. So wherever you live at, that's how it's your domiciles. That's how it's recorded in this case. So as you can see now, as we go towards the right side, you can see the Kearney line is trending up pretty well. You can see the Gothenburg line is taking just a little bit of a jump there at the end. So then that's just a status of where we're currently at.
Yeah, and I think another interesting read on this is the population of Kearney relative to the population of Gothenburg.
Mm-hmm.
Per capita, certainly a more dense positive experience here in escalation than what is probably occurring in what would be a larger community. So it certainly was a trigger to get this group together and educate our people within our community, and probably fairly atypical for Two Rivers to release the by city data, but pretty important to make people aware within our community that we really do need to be taking this serious at this point in time. Next slide, please, Alec.
So this is specific, Nate, just to Dawson County, that age breakout we talked about earlier. So just to give you an idea, what we talked about in Buffalo County, we were really seeing that 18 to 29-year-old pop towards the top. In this case, what we're seeing is that 30 to 39-year-old categorization. And you know, if you think about the population distribution, I don't have it off Gothenburg off the top of my head, But, you think of like a working age population, that's typically what we see. So it does mirror to some extent. Our top line is 30 to 39-year-olds. It's the orange line, if you can see that. And then following close to second place is 50 to 59, and then it jumps down into the rest. Now, just one caveat: when we're talking small numbers, and in a community like Gothenburg, where we don't have like 5,000 cases or 800 cases as an example, it's easy one case can throw and skew that off quite a bit. So just take that with a grain of salt to some extent. But definitely what we're seeing nationally, and even more in the Kearney area, we are seeing that younger population. And when I say younger, I'm saying like about 18 to about 40 is kind of what we're seeing. Is a pretty significant uptick in that population for transmission.
Great. Well, Jeremy and Katie, I can't thank you guys enough for the work that you guys have done on behalf of our community and our whole area, our whole region. So thank you for all the information. With the heightened awareness now that we have, we're going to pivot back to Dr. Dalrymple and ask Dr. Dalrymple to walk us through maybe some of the things that we should be doing now that we're more aware of the risk factors that are even more present in our community right now. Oh, we've got you muted. Sorry, we'll get that. There we go.
Yep.
So
no, that's okay. Thanks.
What about mask wearing? I know that people can make that a political topic. Is that a political topic in your mind, Anna?
I think the answer to this because I already told you earlier. So no, I don't think that's a political issue. To me, it's a health issue. So the research is coming out regularly and is quite, it is not unclear. Masks are very helpful for minimizing transmission, and they are helpful for driving the numbers down to the levels that are safe so that we can start opening up. So if you if you want to go have your kids go back to school, if you like Husker football, like a lot of people I know are asking about that. If you want to go back to some normal way of life, I would ask you wear a mask when you cannot be 6 feet away from somebody, and especially when you're inside. So masks.
And it really can be the difference on whether or not you're asked to quarantine or isolate. If you've had a mask on, if the other person's had a mask on, you've encountered somebody with COVID, it hasn't been for that prolonged period of time, and you did go through the inconvenience of wearing a mask. The good news is what?
Right, you may not need to. So yes, the close contact definitely can make a difference. That can make a difference in what we tell you. So absolutely.
Great. Well, thank you, Anna. We're going to pivot to Dr. Rhodes, but as we do that, really want to acknowledge the collaboration that has occurred between the local school district, the local hospital, and Two Rivers, the health district. Only in Gothenburg do we see the collaboration the way that we have. Dr. Rhodes, can you tell us just a little bit about how the school's been working with the health district and the hospital to come up with a plan for Gothenburg?
Yeah. Thanks, Nate. You are just dead on as it relates to, really what has been one of the positives that I think has come out of this pandemic, and that is that our relationship as a school district with Gothenburg Health and maybe to a lesser degree, Two Rivers Health has really blossomed. And certainly we feel like we're the experts as it relates to education and working with young people. But we really need to rely on those health officials and those health professionals to guide us as it relates to best practices to be able to open up our building and be safe, which is our number one goal. We want to have a safe and healthy environment for our kids and our staff. And then our second goal is to be in person with our students and give them a physical educational opportunity and experience.
Great. I think that's important for people to understand, is that really is, from talking to you, what the end game of the school is to have that in-person education experience, that as graceful as the job that our staff and our community did with the virtual education, it's just not the same as being present. Does that be your take?
Oh, I think absolutely. I think from a mental standpoint, I think from a social standpoint, I think those things are as important as just the educational experience as well. And as you said, kudos to our instructional staff and what they were able to put together in the spring to provide that digital learning opportunity, that remote learning opportunity. But by all means, we absolutely want to be open in person, and our plan is just that. And our plan, we have utilized the health risk dial, that green, yellow, orange, red. Now, determining where we're at on that dial is not our sole decision. That is working in conjunction with local health officials from Gothenburg Health, and maybe to a lesser degree Two River, to really guide us where we're at. But each one of those levels puts into place different types of safety precautions and potentially restrictions to keep our doors open for as long as we possibly can, and have that physical setting. That's just another step in terms of relationships that are so important in schools between teachers and students.
Great. Can you tell us a little bit about when people can expect to see that plan, when that plan is going to be released, when that will be out in the public?
Yeah, great question, and probably the number one question that we've received recently. And first of all, I really want to thank our community and our parents and students for being patient as we worked our way through this. It's been a process to develop this plan. It's been ongoing for what has been about a month. And we just distributed our finalized plan to our staff this morning. It will go live on our website this evening, and that will be accompanied by a call out to our parents and students via our alert system. So that plan will be open to the public later this evening.
Great. A natural question that would go with school, or it's maybe one and the same, extracurricular activities as it would pertain to the school. I think that's a significant part of the school experience. Any thoughts on extracurriculars as it would pertain to the school?
Yeah, I think that's another great question. As some people I think probably are aware, we did currently suspend weight room activities, camps and clinics currently, just based on what we were hearing within our community and the potential community spread. So we did that to be proactive, to make sure that we were taking steps to be able to open our doors on August 13th. As it relates to extracurricular activities, we continue to receive guidance from the Nebraska School Activities Association on best practices to put our kids together in terms of activities. I think our educational system will always come first as it relates to that, but nonetheless, it's an important part of what we do, and in some cases, it's considered the other half of education. So I think we want to be able to provide those extracurricular activities, and we will do so in the most health conscious manner that we possibly can, and we will work with our local health officials to determine what that potentially looks like. So as of right now, our plan moving forward is that we'll use that guidance to make those determinations in the future.
Yeah, and that we are living in ever-changing times. I think probably our situation is different today than it may have been 2 weeks ago, and we'll see when we get to August 13th what our situation looks like then. And in many ways, I'm very proud of our school for being willing to evolve and change based on the most current information that's available. So anything else for the group, Dr. Rhodes?
I don't think so. I think this it really takes a community, and what we've been able to do in concert with Gothenburg Health and Two Rivers, they have just been great in terms of guidance for us as we're moving forward with our plan. And quite honestly, we're extremely excited to get started again and to see kids and open up our doors.
Great. Thank you, Dr. Rhodes. I know we do have a number of questions that we're unfortunately probably not going to have time to get to all of them, but I do want to pivot back to either Dr. Dalrymple or Tina Therian. If either one of you could talk about how prepared the hospital is to react and serve our community as we're going through elevated times that we're in right now.
Yeah, well, I can start. And if Tina, if you have anything you'd like to add, please go ahead and do that. I think we are well prepared. You know, the first time around in March, we really made a lot of contingency plans, so to speak. We made some, you know, we talked about kind of those worst case scenarios and how we would handle everything. So we kind of already have all of that done. You know, we've gotten prepared in that sense. We know exactly where we would place our patients who had to be in the inpatient side for COVID. You know, and we actually have had patients here in the hospital now that have required inpatient status. And so we have a you know, kind of an area to keep them separate from the other patients, or clean patients is what we would call it, to make sure that we're not spreading that virus, of course, in the hospital. And we also have a very fluid structure when it comes to the clinic. So we've gone back and forth a couple of different times on, you know, depending on the need of seeing patients with respiratory symptoms who are possible COVID patients in the rest of the clinic. You know, we have different spaces set aside that we can use for that. We definitely make sure that we're regularly looking at how many supplies we have and how many COVID tests we have. And so I think from that perspective, you know, just regularly checking in on that. We're doing great with that, and knowing that it can change at any time. So.
Great. At one point in time, it was my understanding that Gothenburg Health had a reciprocal agreement and had a plan to not treat COVID positive patients here. Any updates on what that plan has evolved to?
Sure, Anna, if you want to start, you can, and either way, you let me know.
No, go ahead, Tina.
So we were on, so yes, originally when this was all starting, we were all getting ready, March, April timeframe. We had maybe a little more warning as a country, as a nation. And so people had started to sort of, in our larger facilities where they may take your more serious patients, kind of pull back from those extra admissions or elective surgeries, and created this capacity where they would take all of the admissions or the sicker folks, and then critical access or community hospitals would be able to take those minor or not at all, but we would take their clean. So we would stay kind of clean, and they would, it was a bit of a swap, a dance, if you will. This last spike has come on the heels of, as we've all talked about, March or May and June and July, and everybody kind of trying to get back to normal and things kind of opening. So the hospitals around are not having a lot of capacity. They were trying to get back to business. They were trying to get surgeries back on the books and trying to get business going. So this uptick isn't coming with this great bed availability. So we were meeting with some of our hospitals from here, sort of in the westerly region, and the recommendation for them was they don't have 30, 40 beds open right now. They were, you know, trying to get back to normal. So any moderate into minor cases we would be keeping. So more cases will be treated locally and not shifted to and from. Now, Great Plains has and the Kearney facilities that we've talked to are still absolutely honoring, you know, if a patient escalates to a point where it's not a good idea for them to be here, they need a higher level of care, we absolutely can transfer them out, and they have, and they've accepted, you know, when we've needed to. But where we weren't going to take any, you will see us taking a couple of the ones who are relatively stable, but we need to support them. So that is quite a shift. A part of when we learned about it was, you know, I'm sure everyone's heard by now, but Grant had a little bit of an issue where they had an influx in a nursing home, and we were actually reached out to take some of theirs. Didn't end up having to do it, but it will be a little different this time than being able to just do a clean and illness shift, simply because we were all trying to get back to business, and there's not hospitals with big capacities waiting to take everybody's COVID.
Yeah, and I think consistent with any organization, whether it's the medical community, the business community, the school, the city, we're all evolving to do what's appropriate. And if anyone in the community has specific questions as it pertains to any of those organizations, especially the hospital or the medical community, please reach out and get that firsthand information. I know I've had very good luck, and I think other people would too, reaching out and trying to educate themselves. So Jeremy and Katie from Two Rivers, I think we still have you on. If you guys have any closing comments as we're approaching the conclusion of our time together.
Jeremy had to step out. He's a busy guy, but we're glad that he was able to join us for most of it. We want to really hammer home that it's really important to stay away from other people if you are a close contact of somebody who is positive for COVID. We don't know what happens after you've had COVID. We know that you can recover from your symptoms, but we don't know long-term effects. And so we would really impress upon you to protect others, wear your mask, and stay home when you've been exposed or when you're sick.
Thank you. Dr. Dalrymple, any closing comments to share with the group today?
I don't think so. Just wear a mask. I'm gonna put mine back on right now.
Great. Well, a big thank you to all the people that took the time to participate today. On behalf of our entire community, thank you for all the panelists today that were willing to share your valuable time. Here comes the homework assignment that we've talked about at the end of every one of these town hall meetings. For those of you that took the time to listen today, thank you. My ask is that you take the information you've gathered today and spread that to other people. Take the time to educate friends, family members, people in your social circle, and get that accurate information out in the public domain. If your questions weren't answered today, please reach out to those organizations that would have the correct answers that you may be seeking. Contact the school if you need to contact the school, contact the hospital, contact Two Rivers. Each and every one of those organizations is there to provide a service. A big part of their service is getting accurate information out to our community. So thank you, Gothenburg, for tuning in. Please don't forget to do your homework. Stay safe.